Hi, my name is Dr. Amaal Starling. I'm an assistant professor of neurology and a headache specialist at Mayo Clinic in Arizona. And today I was able to do a presentation on the 5 headaches. And really what I focused on is making sure that we look for a secondary cause of headache when someone initially presents with a headache. That is our first responsibility, is to rule out a secondary cause. And the way that we do that is by applying a systematic approach to every patient that has a headache. And that starts with eliciting red flags. And what's key in that is that you have to ask these questions because often patients won't report them voluntarily. And so a good mnemonic for looking for headache red flags is SNOOP4. So the S stands for systemic symptoms, asking about fevers, chills, night sweats, any type of weight change. N in SNOOP4 is neurologic signs and symptoms. So any focal neurologic signs and symptoms like unilateral weakness or numbness, vision loss, double vision, difficulty with speech, or cognitive changes. O stands for older age of onset of that new headache type, anything greater than the age of 50 years. The next O is the onset of the headache episode itself. If it has a thunderclap onset, that is a headache red flag. That signifies a neurologic emergency. And by definition, a thunderclap onset headache is one that goes from 0 to 10 in less than 60 seconds, when a snap of a finger. The next are 4 Ps. The first one is precipitation by Valsalva or by exertion. So someone coughs, sneezes, has a bowel movement, participates in sexual activity. If those things trigger the onset of a headache, that would be concerning, okay? And then the next one is if there is a positional or a postural component to the headache. So if the headache is present when someone is upright, but absent when they're lying down flat, or vice versa, if it's worse when they're lying down flat, that may indicate a problem in CSF dynamics, again indicating a secondary cause of headaches. The next thing that we look for is another P, and that is a pattern change or progressive nature of the headache, where it worsens over time, or before an individual had 2 migraine attacks per month, but now they have a daily headache suddenly. That's a pattern change. And then the last P is pregnancy. So pregnancy, a headache in the setting of pregnancy is a red flag, mainly because of the hypercoagulability that exists in the setting of pregnancy. Also, the fact that there are a lot of pregnancy complications that can present with a headache as a clinical symptom. So you want to first rule out those secondary causes by looking for those headache red flags. You can initiate a workup based on those signs and symptoms that may be present, but then you may have already completed that, and now you can focus on a primary headache disorder diagnosis. And once you have a primary headache disorder diagnosis based on headache duration, the headache episode duration, and associated features, you can use evidence-based guidelines to then treat that primary headache disorder. And the most common primary headache disorder that presents in your office is usually migraine. And oftentimes they may present with an acute migraine attack, which we then will use our evidence-based guidelines to treat.